Thank you so much, Prof, for joining us this evening. First of all, I'd like to get your response to the unbanning of cigarette sales at this time. We know that cigarettes are not healthy, but we also know that if you want to get your cigarettes, you can get them illegally. Do you think that it is good or bad that the ban was lifted?
Well, I think it's perhaps more defensible to lift the ban on cigarettes than alcohol. But, from a public health point of view, it would be better if people weren't smoking. I mean, a recent study done in China of 30 provinces found that smokers were 1.4 times more likely to have severe symptoms of COVID-19 and were 2.4 times more likely to be admitted to an ICU, need mechanical ventilation or die compared to non-smokers. So certainly, even if people can stop smoking for a 2 or 3 week period, their outcomes will be better if they get the coronavirus. But obviously, the government had to weigh other issues like the smuggling and things. So clearly they went the other way on it than I would have gone from purely a public health point of view.
Yeah, I mean, we know that just being told that something is bad for you doesn't stop people from partaking in it. We've known for decades that smoking causes cancer, and yet people really battle to give up smoking. So it is a very difficult one. Alcohol is not allowed at this stage. We have seen, I understand, a decrease in our emergency rooms for alcohol-related incidents. So that's good news in that sense. But some of the suggestions coming from the alcohol industry actually make a lot of sense. So let's, for example, regulate the hours that we can sell alcohol and maybe limit the amount of alcohol that can be bought. Because, of course, again, the bootleg industry is alive and kicking on this one.
Yes, Sally, I think that's only part of the picture. So we limit the hours of sale as for example, the Gauteng Liquor Forum asked to sell from 9 a.m. to 6 p.m. and then have people space as they're queuing and then limit the amounts of alcohol people can purchase. But I think what will happen then is that obviously some people will have other people in the queue, so they will stock up. So limiting the amounts may not work. But I think the problem comes when people return to their homes. So I think there are two issues to look at. Some people will return to their homes and they will then bring alcohol into what's for many people a crowded situation, a tense situation. They've been living with someone, they haven't been able to get out other people, and they'll have a few drinks, and then that can be a very ripe opportunity for interpersonal violence, particularly gender-based violence. There might be harm to children. Some people might even harm themselves. So I think you've got to look at that mix. But then also other people will bring the alcohol back into their homes and they'll have a couple of drinks and they'll decide, particularly when you're looking at crowded circumstances in which many South Africans unfortunately live, they'll have a couple of drinks and then they'll say, you know what, the inhibitions are dropped, I've had enough, I'm out of here, I'm going to go and talk to my neighbors, I'm going to go outside the house and drink with other people. And that's what's going to happen. And then in that circumstance, you'll find that increased opportunities for interpersonal violence, again, fights as the alcohol runs out, and so on. And particularly from the coronavirus situation, I think it decreases the likelihood of people not mixing of that. So you'll find a much greater opportunity for the spread of the virus as well in such circumstances. Community transmission.
I mean, some of your arguments really could be made for just banning alcohol altogether forever and ever. The reality is people will drink, people will find the liquor, and we're seeing that there are all sorts of problems. Some people are saying that they are detoxing from alcohol. It's problematic. The same applies in a way to other drugs. But let's stick with alcohol. Do you think that there is a way through this? Because you, as you say, as a health professional, your response is, look, but happy, because we know that drinking to excess, according to the WHO, really could have an impact on COVID-19 and make you more sick. But we're living in a real world. We're living in a world where people don't like to be told what to do, that we know the health risks and we do things that are dangerous anyway. Just as the government has to weigh up the economic benefits, the health benefits, I'm probably asking you to do the same, and I'm interested to hear from a health professional whether there's any wiggle room.
Well, I think in stage 4, I think the government should stick with banning the off-consumption sales of alcohol. The other reason I didn't go into is that heavy drinking weakens the immune system. We have a situation where where probably 30 to 40% of adults drink, and of those, 50 to 60 drink at very heavy levels. So we're talking of about 18 to 20% of the population, of adult population, are heavy drinkers, and of those, probably a third, so 4 to 5% of the adult population are even dependent on alcohol. So that's in terms of affecting the lungs. There's certainly research coming out of the States showing that heavy drinkers, it does damage the lungs. People don't realize it. And when they have a secondary insult, such as from a coronavirus respiratory infection, then they'll have a far worse outcome. But I think our argument is the strongest point, besides the increasing likelihood of community transmission, which I think is the number one issue right now. We're not talking about prohibition in the long term. We're talking about dealing with this particular crisis, is the effect that opening it up again will have on trauma unit admissions. And we've done some modeling of that to show just how many beds each week, probably about 5,000 beds across 400 trauma units in the country. 5,000 new admissions would occur each week. And at the moment, we might not need them for coronavirus patients, but I bet you in the next week, 2, 3, 4 weeks, we're going to need those beds.
All right, that's a very practical consideration, and thank you very much for your time. That's Professor Charles Parry from the Medical Research Council.